Before the Affordable Care Act, now known as Obamacare, took effect earlier this year, a number of state and county governments across the country got permission to enact part of the law early, the Medicaid expansion. In Cook County, hospital officials saw the expansion as an opportunity to reduce the number of patients who don't have insurance by providing them a program called County Care. That program is turning a year old this weekend. Brandis Friedman takes a look at how it's working.
We're checking you to see if you've lost any feeling in your feet.
62-year-old Rich Romanofsky is feeling better than he did at 60.
No more soda, no more ice cream. All the fun stuff is gone, but I feel better for it.
That's when he was diagnosed with diabetes after his first visit to the Erie Family Health Center in Westtown. His doctor, Lee Francis, says Romanofsky is also being treated for high blood pressure, high cholesterol, and an esophageal condition called achalasia, which makes swallowing difficult.
Richard first came to me with a long list of chronic illnesses, some of which were uncontrolled, some of which we discovered new, some he already had and really needed to be managed. And he really has not had insurance for his entire life.
As a musician who cared for his ailing parents until a couple of years ago, Romanofsky lives on a low income. So the health center let him pay on a sliding fee scale.
Instead of $80, it would be $30 for a visit. And for the blood test, it would be like $11 or something. You know, I'm telling you, sometimes there was no $30. And they let me go. They say, well, don't worry about it.
Erie Family is one of many health centers across Cook County that receives federal and private dollars to treat patients who can't pay for medical treatment. But now that the Cook County Health and Hospital Systems rolled out County Care, those centers will be reimbursed for caring for those patients. After the Affordable Care Act, or ACA, was signed into law, Cook County got permission from the federal government to roll out its Medicaid expansion early. So now, clinics like Erie are receiving payments from the government for patients like Mr. Romanofsky. Stephen Glass, the county health system's director of managed care, says the idea was to relieve county taxpayers of some of the burden of caring for poor patients.
The Cook County Health and Hospital System provides over $600 million in charity care to patients without insurance here within our own system. While we're the third largest hospital system, public hospital system in the nation, we provide more charity care than any one of them, than several of them combined, actually. So when knowing that the Medicaid expansion was coming under the Affordable Care Act, leadership at the time really saw the need to early enroll as a real opportunity to help offset and help stabilize the finances of the Cook County Health and Hospital System.
Glass explains that the county has partnerships with more than 138 primary care locations and 38 hospitals in Cook County, many of which, like Erie, were already treating self-pay or uninsured patients.
Serving the uninsured is not new for this network. They've done this all along. Now we just have the ability to get reimbursed and compensated for it.
Since the start of county care, the Cook County Health and Hospital System says it's noticed a decrease in those uninsured patients, along with a similar increase in county care enrollees. Doctors say these early enrollees are the patients most in need of medical treatment, whose care can be the most expensive.
The patient profile is a patient who is very sick, right? Who has multiple chronic diseases, and many of them have gone, unattended to for a very long time. But what we know is that once those individuals get into care, once people get into a primary care medical home, get to a doctor, that their health will stabilize and that those costs and that utilization of services will go down.
Critics of county care say an enrollment of 70,000 patients after a year is short of the county's own goal of 115,000. And they're concerned that expanding coverage doesn't necessarily mean expanded access.
My big concern with county care is that the Medicaid program is notorious for long waits and a lot of difficulty in accessing care. We know from going into doctors' offices that a lot of doctors are not taking new Medicaid patients. They post signs on their window. And so the big issue one of the big concerns of mine is that what is happening to those individuals who are already facing a lot of barriers to care.
But Romanofsky says he's a living example of how well the program works.
Well, number one, I don't have to pay for my medications anymore. So all my medications are provided by county care. I don't have to pay for my visits here anymore. But what I'd have is peace of mind.
And his doctor would agree.
I think once Richard enrolled in insurance, in this case, county care, his whole demeanor changed. He just became a different person. He started taking care of himself. He sat up taller in the chair and he just felt more proud.
Dr. Francis adds that having this little card has been a motivator for a number of patients to take better care of themselves without fear of a hospital bill later. For Chicago Tonight, I'm Brandis Friedman.
For the first 3 years of the program, the federal government covers 100% of the cost. After that, the federal government covers 90%, with the county picking up the other 10% until the year 2020.